increase in life expectancy will bring several challenges, such as the multimorbidities and poorer health conditions. Being debt frailty is a syndrome that not only has physiological aspects, but also some social factors such as isolation and loneliness. It can be mitigated or attenuated by early intervention. This being said, prevention will allow us to bring more quality of life and to give them a healthier and longer life for older adults.
The main challenge we have encountered is to set up this project within the framework of a health pandemic, a global pandemic that impacted the implementation of the activities and the tasks of the projects, or the mobility of the teams involved in the project, the testing of the solutions.
For Sbramento, as lead procurator, it is very important to create a continuous collaboration with the other procurers in other countries to analyze the best practice and to improve our healthcare and social process. And not only, but introduction of new innovative technology that give an answer of our unmet needs.
Working with older people is very satisfying, but it increments a lot the difficulty when the technology is involved, because you know that the digital literacy of this segment of population is not as good as the population in other younger segments.
Our intention was to get a better insight about the follow-up care of frail elderly persons after the submission process of the acute care that we are providing them with. So this is something that we even got more aware about, that this is still a big problem in Germany especially. So this is something we want to focus on in following projects.
The aim of CSI is to approach digital health to all older adults without considering their digital literacy. Digital health, we think that it can improve their access to the health system and also can improve their quality of life.
For Sbramento, it is important to introduce this technology in real condition with the participation of real operators, and so general practitioner, clinical expertise and the technical expertise that must give an impact of interoperability and impact in the real daily life of our user and our frailty people.
To work with different countries, with different health systems, you need to adapt your solution to the different countries. But probably the most challenging has been the issue related with the piloting, because passing all the ethics process is different in the different countries, and this is something that takes a lot of time and effort.
We think that it's very important, this co-creation part, that we have defined all the solution with all the adults and the healthcare professionals. So it has been a long process of co-creation methodology in which they have been able to co-create and define the functionalities that they like most, the ones that they prefer, the ones that they don't like. So this has been like the innovative part to do this co-creation with this new type of users, which we have never worked before.
Our main challenge, I would say that it was the digital skills that we faced working with these old adult users, because they know less technical skills maybe, and this was the part that was worst for us to adapt the solution to this type of users.
If I started again this project, I should ask the consortium to keep the multidisciplinary teams all over the project to be sure that everybody is involved and has a strong commitment with the final goal of the project.
I would recommend to talk to your ethical and legal departments, because this project needs a lot of support from this kind of professionals.
It's very important to test the solution in different locations, because different locations you learn different situations that you in the lab didn't take into account. And this has helped us to have a better product and probably also to prepare in a better way the following steps of the development.
Initiatives like this one are a great opportunity for companies to test their solutions in the real environment with real patients and to co-create these solutions with procurers and hospitals. But the real challenge is how to get an impact with the adoption of these solutions once the project gets to an end.
I think what we have learned mainly with eCare is how important it really is to make sure that we are communicating properly, that everybody is sure of what they have to do. So having a strong leadership, good communication, sharing knowledge, sharing all the good practices that we have, that's very important, because sometimes we realize there are other things that we could have shared that could have maybe made the process easier and just smoother for everybody.